After FDA approval, a major logistics operation underway to get millions of doses of the country's first COVID-19 vaccine to hospitals. The FDA granted emergency use authorization to Pfizer last night, and today, a group of advisors for the CDC gave their endorsement. The first shipments of Pfizer's vaccine will soon leave a manufacturing plant in Michigan, headed to FedEx and UPS distribution centers. And that means Oregon and Washington could start getting the vaccine doses in just the next few days. Galen Etland breaks down the plans and why there are still big question marks.
Dara Isaacson made headlines during a COVID-19 news conference with Oregon Governor Kate Brown this week.
I realize that most of us don't like to be told what to do, especially when we feel that we're not necessarily part of the problem.
The Portlander is a long hauler, someone who got sick with COVID 10 months ago and is still having serious breathing problems.
I can barely walk around the block now.
A vaccine could help people avoid her situation. Hospitals like OHSU can't talk specifics yet, since info on the vaccines keeps changing. But many, like the Portland VA, expect thousands of the Pfizer vaccines delivered this week. In the coming months, Oregon's 360,000 healthcare workers are first in line.
It includes, of course, our staff at our long-term care facilities.
The federal government is shipping out doses based on state population. Governor Brown says Oregon will get 147,000 doses by the end of December. After that, it's up in the air.
We have no further commitments of deliveries from the federal government.
So it's really impossible for us to put a specific timeline on that.
Washington State will also give healthcare workers priority starting next week, followed by essential workers and high-risk adults over 65. The next dose would be early in the new year. Pfizer says everyone else might wait until around June. Washington expects 220,000 doses of Pfizer's vaccine and 180,000 of Moderna's by the end of December. Oregon, meanwhile, wants to vaccinate 10,000 people a day to reach community immunity of 75%.
We'd like to get Oregon open as quickly as possible.
Oregon has 4.2 million people. 3/4 of that is around 3 million. So immunizing 10,000 a day would take about 10 months, leaving us at September before enough people are immune. But more vaccines could speed that up. In the meantime, Dara Isaacson urges Oregonians to maintain COVID prevention.
The alternative is way more exhausting.
I'm Galen Etland for KGW News.